great to hear from everybody about the different responses that organizations are taking. And I'm seeing a lot of resilience in both the responses of these community organizations as well as their partners here in the US. We're going to take time now to do a breakout room activity. Shaylin will break you up into 4 different breakout rooms. You have until 7:30 to address the prompt that is in the link that I just sent to a shared Google Doc. You'll want to work with the facilitator in your room to work through the prompt, answer the questions, take down notes, and then assign one person, this is important, to share back with the rest of chapter when we return at 7:30. So, Shaylin, if you're ready, we can break up into rooms. Okay, welcome back from your breakout rooms, and we will get started with a large group shareback. So we're going to hear from each, like a representative from each of the groups. I'm going to put up the situation right now. If somebody from breakout room number 1 doesn't mind reading the situation and then talking to us about how they answered those questions or what responses you would have suggested.
Yeah, so for our breakout room, our situation was that we're working for a medical organization at the US-Mexican border, and the number of COVID cases have been steadily rising. And we only have 2 hospitals, and they're rapidly filling up. And there's also restrictions on funding and PPE, which limit our ability to help our patients. So some of the main things we discussed is focusing on the elderly and children and people who have more of a risk, such as people with like pre-existing health conditions and that sort of thing. And then also focusing a lot on prevention, and some of the ways we can do that is by telling others and then having them tell their families and friends and that sort of thing, so we can get more of a reach than just than otherwise. And then also separating the hospitals into, like, one hospital would be for more severe cases, and then one would be for less severe cases, or like just going for checkups or that sort of thing, just so we can try to prevent the spread of COVID. So that was the main things we talked about.
I like it. Yeah, and especially in that first point about focusing on the elderly, children, and people with pre-existing health conditions. This is how we can be the most effective at ensuring that the money and resources we have the greatest impact, are addressing the most vulnerable populations. Thanks for sharing, Brooke. We will move on to somebody from breakout room 2. So again, if you could read the situation and then talk us through some of your ideas.
Hello. So our situation, sorry, just one second. Our situation is, sorry. You are the program, or the director of a program that works to educate impoverished communities on personal hygiene, reproductive health, and women's health. The majority of your education occurs in-person workshops or through in-person workshops, and the communities you are trying to reach have limited internet access for virtual workshops. COVID-19 has spread into your region, and in-person group workshops are no longer a feasible option. So a few things, our discussion prompts were: how will you continue to serve the communities in the face of the pandemic? So we talked about providing resources such as masks and hand sanitizers and soap for the community members to access. Obviously, by doing this, we would still be ensuring that we're having social distance measures, but it's important to still be checking in on your community, asking how they are, and just providing them with masks and stuff like that to maintain the spread of COVID. Other things that we talked about are how would we find different avenues of educations that we can use to help our members. So we just talked about partnering with local organizations like barbershops or salons to disseminate the information, and kind of just using the existing relationships that people have in their community, such as like finding the leaders of the community and just sort of using a pyramid scheme where we give the information to specific people in the community and ask them that in a social distancing and safe way that they talk to smaller groups about that information. Also, we'll be teaching or telling them how to like make sure that they are keeping down the spread and helping their community members do the same.
Awesome. Thank you, Emma, for sharing. I especially like the other avenues of education that you and your group talked about. Finding a point person, the community leaders, trusted community members who can educate the rest of their community about COVID-19, hygiene practices, and avoiding those large workshops. Instead, like limiting gathering sizes and focusing on person-to-person communication. It sounds a lot like what our partner SAW did with the peer educator model with the CHOP program. And having those peer educators living in those communities was critical to how SAW had a response to the COVID-19 because they were able to communicate to peer educators and then get that information to the communities. Okay. We will move on then to breakout room 3. Same deal. Someone can be brave to share what they talked about and first read the situation.
I don't think we assigned somebody for breakout room 3, but I can go ahead and try and do this. So the situation is you are a doctor for the only clinic in a rural community during the rise of COVID-19 cases. Before the pandemic, your job included in-person visits, both at the clinic and at homes, and holding healthcare education seminars for the community. However, you and the other doctors have growing concerns about the rapidly spreading virus and still being able to see patients, especially since this is the only clinic in the area. So for the prompts, it was kind of like, would you still do in-person home visits even though the virus could be spreading? And then what are some of the protective measures that you would take? And then what are some other techniques that you could probably provide that would help provide care to members of the community? So we definitely thought that limiting in-person home visits to only like very critical cases and like super necessary scenarios is probably the good way to go about it. We made a stipulation that in a rural community, there probably isn't a lot of technology. So treatment methods and like, lots of things that COVID patients might need and get from urban hospitals may not be available in rural settings. So this makes a lot of treating COVID patients much more difficult. But I think we mentioned that testing the citizens in the community should be like the primary, or the first task that we do, because if we know who is infected and who is not infected, we could start making a plan for who needs to be isolating and who needs to make sure that they're not bringing people over. And yeah, for a public health standpoint, making sure that we're wearing our protective equipment, making sure that we're washing our hands, wearing our masks when we go out is important. And then yeah, so we thought about holding health events if the cases aren't terrible, but there still needs to be proper precautions like social distancing. And we thought about utilizing flyers or having like key community members or authority figures spread the information that would help prevent the spread of the virus. So yeah.
Such a diversity of thoughts in how you respond to that prompt. I'll just add a quick thought that the doctor clinic in this community is kind of a role model they might be the only medical professional that this community has access to, and they have to play a role of a public health official as well if they're performing contact tracing during this time. So it's really up to this person to model what good hygiene looks like, what wearing protective gear, what taking proper precautions looks like. And again, you can see the trust that communities place in their leaders. All right, we're gonna move on to breakout room 4.
All right, that's me. So I'll go ahead and read the situation. So you're part of a committee within a nonprofit similar to SAW that makes clothing and handbags as a form of employment to those who need it and a way to raise funds for the nonprofit. Due to COVID-19, it is difficult to meet in groups and be able to sell the products. So we talked about a lot of things. The first thing we talked about was how potentially by using like social distance practicings and masks, you could still have groups of like just a couple people to work on making the products. We couldn't really think of a better way to do that because, you know, you obviously have to like make the products to sell them. And unless people are going to work alone, that was like kind of the best solution for that aspect we could come up with. And then we talked about how you could sell the products on an online platform so funds can still be given to the people employed. That potentially would or wouldn't work depending on internet access and wherever this hypothetical situation would be, but ideally selling them online could potentially work for them and maybe even be a better avenue. And then we also talked about how you could make masks with the extra fabric because A, that kind of fits the COVID situation, and B, masks aren't very big, obviously, so you could potentially use the scraps you would otherwise throw away, and then you could be making money off them, and it would also limit fabric waste. And then the last thing we talked about is you could advertise the items based on season and holiday. So obviously, depending on the time of year, sales can kind of differ for places. Lots of businesses have holiday sales, holiday themed clothing, etc. So potentially kind of like using the holiday season as a way to bring more attention and more excitement to the product could work.
All right, thanks, Elizabeth. And even though this is a hypothetical situation, it sounds very similar to what the income generation program at SAW's Healthcare House looks like. So perhaps something to consider for future projects and future partnership ideas. So that brings us to the end of our presentation today about partnerships and COVID-19, how SAW and a host of other organizations have adapted. You all have put to practice some of what you've learned from the presentation today. And if you have any questions, again, feel free to shoot them in the chat and we will get to them. Otherwise, this was our final partnerships presentation of the semester, and we are still looking out for one event that is partnerships related. It is a Skype call or a video call with ATL. We do one every month, and all of chapter is welcome to attend. So if you want to hear more about how SAW is adapting to COVID, what the results of the election in Myanmar, which is taking place today, if you want to hear ATL talk about politics, you could talk about that for hours on hours. So we'll send out a message with the date when it's finalized, but be on the lookout for that sometime in the next 2 weeks.
Awesome. Thank you, Matthew, and thank you, Partnerships, for sharing all about honestly, it's just so many different globe